Trauma-informed care is an approach to care that is based on the understanding that trauma is widespread and can have a profound impact on people's lives. Trauma-informed care providers seek to understand the impact of trauma on individuals, families, and communities, and to create environments and practices that are safe and supportive for everyone. Trauma is a deeply disturbing or terrifying experience that overwhelms a person's ability to cope. It can be caused by a single event, such as a car accident or a natural disaster, or by repeated experiences, such as child abuse or domestic violence. Trauma can have a significant impact on a person's physical and mental health. It can lead to symptoms such as anxiety, depression, post-traumatic stress disorder, PTSD, and substance abuse. It can also make it difficult to maintain relationships, succeed in school or work, and cope with everyday life. Trauma-informed care is important because it can help people to heal from trauma and to live full and productive lives. Trauma-informed care providers are trained to recognize the signs and symptoms of trauma, and to create environments and practices that are safe and supportive for everyone. Some of the principles of trauma-informed care. 1. Safety. Trauma-informed care providers make sure that people feel safe and supported in their care. This means creating a physically and emotionally safe environment, and being respectful and supportive of people's needs. 2. Trustworthiness. Trauma-informed care providers build trust with people in their care. This means being honest and transparent, and keeping promises. It also means respecting people's privacy and confidentiality. 3. Choice. Trauma-informed care providers give people choices about their care. This means respecting people's preferences and values, and giving them control over their treatment. 4. Collaboration. Trauma-informed care providers collaborate with people in their care. This means working together to develop a treatment plan, and making sure that people's voices are heard. 5. Empowerment. Trauma-informed care providers empower people to take control of their lives. This means helping people to develop coping skills, and to build resilience. Trauma-informed care is important for everyone, but it is especially important for people who have experienced trauma. Trauma-informed care can help people to heal from trauma and to live full and productive lives. Examples of trauma-informed practices in different settings. 1. Healthcare. Trauma-informed healthcare providers may screen for trauma history, offer trauma-specific treatments, and create a safe and supportive environment for patients. 2. Education. Trauma-informed educators may learn about the impact of trauma on learning, and develop classroom practices that support all students. 3. Child welfare. Trauma-informed child welfare professionals may learn about the impact of trauma on children and families, and develop practices that promote healing and resilience. 4. Criminal justice. Trauma-informed criminal justice professionals may learn about the impact of trauma on people who have been involved in crime, and develop practices that support rehabilitation and reintegration. Trauma-informed care is a growing movement that is changing the way that services are delivered to people who have experienced trauma. By understanding the impact of trauma and creating safe and supportive environments, trauma-informed care providers can help people to heal and to live full and productive lives. Some additional benefits of trauma-informed care. 1. Improved outcomes. Trauma-informed care can lead to improved outcomes for people who have experienced trauma, such as reduced symptoms of PTSD and depression, improved physical and mental health, and increased resilience. 2. Reduced costs. Trauma-informed care can help to reduce the long-term costs of trauma, such as healthcare costs, criminal justice costs, and social service costs. 3. Increased well-being. Trauma-informed care can help to improve the well-being of everyone involved, including people who have experienced trauma, their families, and their caregivers. If you are interested in learning more about trauma-informed care, there are many resources available online and in libraries. You can also find trauma-informed care providers and organizations in your community.